Okay. We'll go ahead and get started. Good morning and good afternoon, everyone. My name is Ashley. I am the coordinator here of the Bold Public Health Center of Excellence, alongside Elma, who most of you are probably used to seeing on these webinars. So I'll be stepping in for Elma today, but I'd like to welcome you all and thank you all for joining us on our webinar today to learn a little bit more about memory cafes and how public health can support their growth in local communities. So I'm excited to have a panel set up for you today to learn a little bit more. But before we get started, I'd like to ground us in our land acknowledgement and just acknowledge that the University of Minnesota is located on traditional, ancestral, and contemporary lands of Indigenous people. We acknowledge with gratitude the land itself and the people. We take to heart and commit through action to learn and honor the traditional cultural Dakota values, courage, wisdom, respect, and generosity. And as I'm sure you'll see in the work today and in the work of our center. Many of you are probably familiar with our center, but for those of you who are joining for the first time today, the Bold Public Health Center of Excellence on Dementia Caregiving, or PICO for short, is designed to support the work of state, local, and tribal public health agencies nationwide as they develop their infrastructure and programming to support dementia caregivers. So we do this in a couple different ways through improving access to evidence-based programs and best practices, facilitating connections and collaborations among public health agencies and a wide range of other service organizations. And we also provide technical assistance for identifying, selecting, implementing, and implementing effective public health interventions and strategies. So I encourage you to visit our website. You can scan the QR code here. I'll also put that link into the chat here in just a moment. So just some reminders for today's webinar. Please submit your questions for our speakers using the Q&A feature that's usually at the bottom of your screen. Our chat is also available. We encourage you to chat among one another, share comments, resources, links, things like that. Do try to put your questions in the Q&A feature though, as much as possible. We will answer some Q&A during the webinar itself, but we'll also save some for the end of our webinar. So we'll answer some of those then. The webinar today is being recorded. The slides and resources will all be shared shortly after today's event, so you can expect to receive those in email within the next couple of days as well. And we do invite you to please complete our survey at the end of today's webinar. We really do take your feedback seriously and we use it to shape our events and the webinars that we host. So this link will pop up when the webinar ends today. I'll also put it in chat, or you can scan the QR code, but we really do appreciate your feedback and thank you in advance for taking your time to do that for us. So before we get started today, we do like to see who is all joining us in this virtual format. And we'd like you to complete or just provide some information in this poll here that I'm going to launch. So you should be seeing a poll on your screen and just asking you to select the capacity that you're attending today's webinar in. So I'll just give it a moment here. This helps us see, how many of our bold public health agencies are attending, community service organizations, and things like that as well. Okay, so it looks like about a third of our attendees are joining us from some sort of community organization or service provider organization role. We have another chunk of people attending us from our Bold public health agencies, and just from other public health agencies in general. So maybe not Bold related, but thank you all for joining us. We do have some as well who identify as a care or a clinical professional, about 15% of our attendees, and then 20% who say they are other and don't fall in any of these categories. So thank you for joining us today, and we'll go ahead and introduce our speakers here. Okay. So again, we are excited to talk about today's topic and discuss how public health can support memory cafes in their local communities. As we know, public health prioritizes strengthening social and community supports so that people living with dementia and their care partners can stay active in their communities. And one way to do this is through memory cafes. So the primary goal of memory cafes, which I'll let our speakers talk to a little bit more, but is to reduce social isolation that often comes with dementia for both the person living with dementia and their care partners. Memory cafes are welcoming, inclusive environments for people living with dementia and their care partners to come together and socialize and support one another. So memory cafes often use local spaces and partnerships to further build on existing community assets already available in the community. Research is also starting to show benefits of memory cafes, and we see that expanding access to memory cafes could be a public health strategy to strengthen community support for those living with dementia and their care partners. So today we're happy to introduce our speakers. We'll begin with Sam Goodrich, who will tell us a little bit more about memory cafes and the Memory Cafe Alliance, and specifically what the Memory Cafe Alliance is and their goal to sustainably increase the number of memory cafes across the country. We'll also hear from our panelists who can share a little bit more about how and where they're integrating memory cafes into their community. So we have Angela Myers joining us from Wisconsin as part of the Bridges Library System. Kathy Chaperon and Emily Storms are also joining us from Indiana, specifically the Marion County's Bold program. And then we'll close the conversation chatting a little bit about social prescribing with Beth Solzberg. So she's the director of the Alzheimer's and Related Dementias Family Support Program at JF and CS of Greater Boston. So we'll discuss a little bit more about tying clinical care into memory cafes and referrals to such programs. And before we hang up today, we also have a new exciting toolkit that we're excited to share with you all. So we'll touch on that before we leave today as well. So without further ado, I'd like to turn it over to Sam. And Sam, welcome. Thank you again for joining us today. And we're excited to hear a little bit more about memory cafes and the Memory Cafe Alliance.
Well, thank you so much. It's quite the honor to be here. I want to make sure I'm able to share my sound here. Ashley, it actually says I cannot share my sound. I do have that one video. Is there a way for me to do that?
Let me look into that. If you want to get started,
yeah,
first
and
comes
we can even send you the link and maybe you can share it if
Sure.
you're able to. But it is a great pleasure to be here with all of you today to talk about one of my favorite topics, memory cafes. So Ashley, you did a great job giving a high-level overview about what memory cafes are. They provide welcoming social gatherings for people living with changes in their memory or thinking, and then those that care for them. Here's that video, but I'm going to keep going and we can always circle back to it. So who are the main people that memory cafes serve? So memory cafes are unique in that they serve both the person living with dementia or neurocognitive changes and the person who provides the care for them. So many programs that are offered for people experiencing neurocognitive changes, uh, it requires the caregiver to drop them off, right, and to have some respite for the caregiver away from the person experiencing dementia. uh, Memory cafes are almost more of what I would call an active respite, in that it provides meaningful opportunities for the care partners to come together in a safe, supportive space. They're able to engage with one another and connect in a way that maybe they aren't able to as frequently anymore at home. And it allows for them to sort of, it's like an equalizing space where they can meet together and really connect with one another again. So there are many benefits to memory cafes, and I'm going to focus on two of them here. The first being that it fosters meaningful connections in order to reduce social isolation. So we know that loneliness is highly prevalent in older adults, and that loneliness often increases when someone is experiencing dementia. Many people they may have been close to will pull away because they're not sure of how to connect with them anymore with these changes in memory and thinking. Uh, Similarly, the caregiver who is caring for them feels that pullback from their standard um, social interactions, and that can be extremely isolating. The Surgeon General defined loneliness as an absence of perceived meaningful connections, and memory cafes absolutely provide a space for those meaningful connections. Um, so it also, from the caregiver perspective, gives a space for them to meet with other caregivers, right? And be in a room of people who have a much better grasp on what they might be dealing with day to day. So it's a really, really beneficial community space for them, very enriching for both sides of that care partnership. The other main benefit I want to highlight today is the reduction in stigma. There's a lot of stigma that surrounds dementia, neurocognitive changes, and caregiving. A lot of people who provide care don't even refer to themselves as caregivers because it has this connotation of just something unpleasant. But if any of you are caregivers on the call, I'm sure you know the duality of the challenges of caregiving, but also the reward of caregiving. But in this space, participants are not asked to disclose their diagnosis. They can leave their diagnosis at the door. They can share it if they choose, but they are not required to. And this type of programming supports people through their disease progression, which is also a unique thing about memory cafes. So it offers accessible, equalizing programming that's really encouraged, so that oftentimes you can't even tell who the caregiver is and who the person with memory loss is. It's a very unique piece to this program. And it offers a safe space within the broader community for them to be seen and be a part of in a really supportive way. It helps challenge other community members or staff's assumptions of what it means to have dementia and what it means to be a caregiver. So there's so many benefits to that include, increase in well-being, purpose. It reduces caregiver burnout, etc. So there's memory cafes offer a unique take in that they can have a really large impact in a community, but at a pretty minimal cost, all considering. So research is beginning to emerge. There's some research out there, and we're working towards creating an evaluation tool that will be shared broadly with memory cafes and lead to hopefully more evaluation supporting these benefits. So let's get into the details here. Where do they happen? When do they happen? What's cool about memory cafes is that they're very grassroots. right? They pop up anywhere, they can happen anywhere, and they all look a little bit different. And that is really a beautiful thing because we want them to support their community, their audience, and be able to have just more specific type of programming and opportunities for the people that they serve. Since groups of people are have different needs and interests, I think it's really important to point out that memory cafes are supported in their differences, but they do have a lot of commonality as well. Uh, they often happen 1 to 4 times a month for about 1 to 2 hours. Within that duration, there's a part of the time that is dedicated to socialization. Uh, Oftentimes includes snacks as well, refreshments. The other portion of that is accessible programming for people to participate in something as a group. And that can really have a range of what that programming may be. It may be dance, storytelling, it might be discussion, games. Some memory cafes do volunteering. There's so many different ways that programming can be. The key there is that it's accessible for both partners, the both care partners, the person experiencing memory loss and the one caring for them. And as a group, that there's something that they're working on together, which can really add benefit. So, what's another unique piece here is that memory cafes are not a profit generating program. Most of them are free of charge. We, as the Memory Cafe Alliance, encourage all cafes to be free of charge to the participants. Some may require, offering a donation or ask for a donation just to cover those basic costs. Maybe there's a sliding scale of contributions, but most often they're free events and they're all different. So people can attend as many as they like. They can happen in person or virtually or hybrid in rare occasions. And we ask that they happen in accessible community spaces. So that might be supermarkets, libraries, faith-based communities, museums, restaurants, senior centers, excuse me. It ranges quite a lot. The key there is that there's parking, there's bathrooms, there's accessibility, ADA compliance, and it's easy for people to get there. But we encourage people look at these community spaces that are maybe not just for senior programming. It can be really special to invite them into a community space that is used by the entire community. So what is the Memory Cafe Alliance? So the Memory Cafe Alliance was formed in the last couple of years to sustainably increase the number of high quality memory cafes throughout the US. We started as an alliance of the EMC squared group, which was enhancing meaningful connections and expanding memory cafes. We had a large alliance that I'll chat about in a little bit here that worked to create the plan of how can we sustainably increase memory cafes. Tenfold is our goal, tenfold in the United States. Well, we decided through this planning process that there are 5 key strategies that we need to meet this goal. The first one is creating a new online directory, and this is live. This came out towards the end of last year. There was an existing online directory, so the groundwork was already there for us. We worked with that person. We partnered with that developer. We have the same URL. We wanted to make it as easy as possible for people searching for cafes to not have any lapse in their searching. It's now hosted by Dementia Friendly America, which has a slew of additional resources for memory cafe leaders and folks looking for this type of programming. We removed all of the ads. We increased the ability for it to be very user-friendly, functional. It's reliable and accurate. We have a requirement for people to update their cafes as often as they change, or at least once a year. So we're keeping this as accurate as possible. We don't want to have cafes that have closed on this directory. I took a quick screenshot here, but Beth will add the link to the directory in the chat, memorycafedirectory.com. Once you put in here, I just put in Milwaukee, and you can change the radius of how far you're willing to go. You can also choose additional filters for virtual cafes or in a different language. But once you have the offerings in your area populate, I circled there's an option to print or download a PDF that shows the cafes that meet those criteria. And we wanted that to be a key part of that, so it's easier for providers to look up the programs in their area and recommend them, refer them to the folks experiencing dementia or maybe recently getting a diagnosis. So it can be a really great resource that way. Strategy number 2, create a national training system. So we wanted to create a national training system that would be built on the best practices of adult learning. We wanted it to be built off of the experience of existing memory cafe leaders in that network. We're not trying to rebuild the wheel. We're trying to make it stronger. So that's been really an important piece there. We're committed to recruiting and supporting memory cafe leaders from under-resourced communities to increase their opportunities to provide this in their areas. We want to be community-centric, which means we're flexible in the design to enable local strengths to flourish. We want options that support the costs associated with the time that it takes to create a new memory cafe. And we want to offer ongoing learning community to support and the sustainability of cafes. So I'm going to take a second here briefly to chat about the 3 different types of the training that we'll be offering. So this first one is live. You can create a free account and access the self-guided online modules. There's 3 sections here, and this is sort of the foundation of the training system. We include a module for operations, a module for an introduction of dementia and caregiving from the lens of a memory cafe. And the last one then talks about program facilitation, how to make programming accessible. These 3 portions were designed so that most trainings require you take it in order and complete every bit. We actually learned that the folks taking advantage of this training may only need 1 section or may want to share 1 or 2 of the sections with the volunteers that are helping them out. So it's very flexible in how people are able to use them. Again, honoring the grassroots and the differences in memory cafes, but still providing that strong foundation for them to come back to. The group self-directed option builds from that. It includes the online modules, but then it also offers a chance for groups, often within a same system, maybe a group of libraries, a group of museums or faith communities, YMCAs, and they can work with a regional training hub for 3 virtual coachings guided by experts selected for their group specifically. So it's very, very geared towards that specific system that they may be coming to us from. Again, building on that online training with additional coaching that supports their expansion. And lastly, we have the cohort expert trainer pathway. This is the greatest level of support. It includes a good amount of financial support to help these cafes start up their programming and help them sustain it. So there's money that goes right to the cafe for their time and startup costs. They experience 5 monthly synchronous virtual or in-person sessions that focus on the special challenges of designing and running a memory cafe. And this helps them create an operations plan by the end of this cohort to start their cafe. So they feel ready to go at the end of this cohort And this is ideal for starting memory cafes in new sectors or communities that are not yet served by memory cafes, because it has that additional support. Strategy 3. I'm checking on time too. So strategy 3, run a public awareness campaign. Many of you probably knew a little bit about memory cafes when you signed up for this webinar, and maybe not. We've found through some focus groups that many people are still, they're not sure what a memory cafe is. So it's crucial to our progress that we work to make memory cafes a household name and make people very aware of the benefits of it. So we're currently in the process of rolling out a public awareness campaign in collaboration with Dementia Friendly America. But we will, continue to find all the different ways that we are able to spread awareness about what a memory cafe is. And that's both for the folks that are looking for a memory cafe or might be interested in joining, and people who may be interested in starting their own memory cafe. So all of our strategies really cater to both of those audiences. Strategy 4, engage networks of those with allied interests. I mentioned the EMC Squared Alliance before, and all of these little logos here represent the folks that were a part of that alliance. Really great group of people. We hope to engage them through not just the planning process, but also the implementation and establishment process. We are really lucky to be working with them. We're also really, really lucky to be working with a group that Beth Salzberg created called the Percolator Group. And that, Beth, you can share how many memory cafes are a part of that. I know it's many. And it's a wonderful group. We want to support that continuation of that ongoing group learning. And we will be transferring that to a learning community on Dementia Friendly America. So it's all in one place for them. And this will offer ongoing, office hours or check-ins, the Percolator idea exchange meetings where memory cafe leaders can share what's working for them. It's really crucial, I think, to maintain that support nationally with folks all over the country doing this great work. And lastly, I won't get into this too much because this is Beth's deal, but the 5th strategy is to support social prescribing. And why social prescribing? Because it has great potential for supporting sustainability and increased reach through provider referrals and insurance reimbursement. So I won't give any spoilers about that. I'll leave that to Beth, but those are our sort of 5 strategies to increase memory cafes.
Great, thank you, Sam. And I do have that video available, so let's try to see if we can get that to work here.
Thank you.
So we'll backpedal just a little bit, but let me know if you can hear the sound.
Memory cafes are welcoming social gathering.
Okay, give me 1 second. Let's see if I can do it quickly.
Ashley, I heard it.
Oh, you did hear it?
Yes, yeah.
Oh, okay. Then never mind. All right, let me start it over again.
Memory cafes are welcoming social gatherings for people with cognitive changes or dementia, along with caring family members, friends, and professional caregivers.
It's a social hour which we all need.
We feel very normal.
At a memory cafe, you'll experience joy, community, and a chance to learn new things.
I learned that we're all human in a memory cafe.
I learned joy at Memory Cafe.
I learned about the power of community at a memory cafe.
You may find guest artists, musicians, and dancers, or educational programs at a memory cafe. But above all, you'll find a place to connect with others who understand what you're going through because they are experiencing something similar. These gatherings are free. Be a part of a growing community of memory cafes nationwide and join us.
You should join us next time. You should join us next time.
Please come and join me next time.
Come and join us.
Learn more at memorycafedirectory.com. You can find a cafe near you or learn how to start one in your community.
Thanks for participating.
Stop.
Thanks, Ashley. I think it is important to share that video because when we're talking about a beautiful opportunity for connection, it's one thing to talk about it, but it is another thing to have a video and look into a memory cafe. So I encourage you to find one in your area and also visit it, because there's nothing we can say can quite measure up to actually experiencing it.
Absolutely. Well, thank you, Sam, for setting the stage, telling us a little bit more about memory cafes and the Memory Cafe Alliance. And I think this segues nicely into the next portion of our webinar we'll begin with Angela Myers, who can tell us a little bit more about where they're hosting memory cafes in Wisconsin. So I'll turn it over to you, Angela. Angela, I think you're muted if you're talking.
Yep, I just realized that. So after 5 years, I still haven't figured out how to unmute myself at the right time. So here I am, and I'm from the Bridges Library System, which is located in southeastern Wisconsin. And library systems in Wisconsin are made up of a consortium of libraries. So within our library system, we have 24 public libraries, and we are located in kind of a rural suburban area of Wisconsin. And from that, we have developed what is called the Library Memory Project. And that has been going on for just over 10 years, which is just so hard to believe that we have been going at this for 10 years now. So I mentioned earlier that we have 24 libraries in our library system, of which 21 of those libraries are now participating in our library memory project. It didn't start off as 21. We actually started off with just 4 libraries, which are actually highlighted on the screen with the orange markers. You'll see it kind of in the upper right quadrant. So it was Pewaukee, Heartland, Delafield, and the Town Hall Library. We actually learned about memory cafes through a Wisconsin Library Association conference, and we took about a year to research what are memory cafes. We visited a memory cafe up in the Fox Cities in Wisconsin. And then our libraries came back together and they said, well, we would love to do this, but we can't necessarily do it alone every single month because it would just be too much of a lift. So that's actually how we developed our rotating cafe model. So what that means is that each of the libraries within each project actually rotate hosting the memory cafe. So one month, one library will host it, and then the next month, the partnering library will host it. The idea is that the librarians actually support one another by attending each other's memory cafes so that they can have another set of helping hands, as well as having face recognition for those that attend. So we now currently have 6 project areas as part of our library memory project. They all rotate with the exception of one, which is the Waukesha Public Library. That is our largest library in our library system. It's kind of centered to the right on your screen with a yellow dot. Their service population is close to 90,000. So they are able to sustain a memory cafe that is offered every single month at their location. And each of our memory cafes are 1.5 hours. And they do vary in the time of day and the day of the week. So a lot of them are actually offered from 10:30 until noon. And then we do have other ones that are offered from 1:30 to 3, and then we have a 3 to 4:30. And there are benefits and drawbacks to each of those times. So we're trying to reach different populations, different schedules by having them at different times of day. You can see all of our different partnering libraries on our website. It's librarymemoryproject.org/partnering-libraries. And then you can kind of dig around a little bit more on the website as well. A lot of people ask us how does participation look, or what is our attendance? So I pulled the last 90 days of attendance at our memory cafes, And each of these bar graphs will demonstrate like what you're seeing at each of the project groups. So on the left-hand side, we have our Wild Plum group. So they hosted 3 times within that grouping of libraries, and they had a variance of attendance. So 10, 11, and 16. And that's a suburban library group. And then we have Running Waters, which is a much smaller rural group. They have much smaller attendance. They do need to work on their promotion efforts. We have seen higher numbers in the past, so that's something that I'll be working with them on since I'm the coordinator of the project, and I can kind of see things at a little bit of a higher level and can kind of encourage them in those ways. Waukesha is the third bar graph, and that is the library that hosts every single month, which definitely has its benefits because you have that routine. They see some astronomical numbers, 67, 71, and 54. So they have a pretty large community space where they host that. And then kind of scooting all the way over to the right, I just wanted to highlight that we do offer something called Family Day. We offer it twice per year, once in the spring, once in the fall. The one that occurs in the spring is in our rural communities, and that happens on a weekend, and that allows additional family members to attend with their loved ones. It's a 3-hour event, so it's kind of like a super memory cafe. We have lots of activities, photo opportunities, all kinds of good stuff, refreshments. So Spring Family Day brought in 22 people, and in fall we had about 90 people, and that's more of in our suburban area. So that one has come to be a very popular event because people love to show their extended families what they're doing at Memory Cafe. And I could not do any of this without our partnerships. We work very heavily within our library memory project with our local libraries. So like I mentioned earlier, our librarians help each other out. So in this photo, in the very, on the left-hand side, the back left corner, there are 2 individuals standing. The person on the left in the purple shirt is the library person who is facilitating the memory cafe, and the person in the blue jean jacket, she's come from another library to assist. And then there's another person standing on the right hand side in the light purple, also from another library to assist with this memory cafe. So when we have smaller libraries, we often don't have a lot of staff that can help with this sort of thing. So by having the other library staff come and help, it's very beneficial. In the middle, we have our dementia care specialist in our rural community. She often comes to our memory cafes and offers support to the caregivers and the persons living with. And then on the middle picture on the bottom, those are dementia care specialists that are in our Waukesha County area. That's our more suburban location. We're very fortunate to have dementia care specialists in every single county of Wisconsin. And here in Waukesha County, we have 1.5 FTE. So we are so lucky. On the right-hand side, very excited to share that we offered our first bilingual memory cafe just last week, and we partnered with the Hispanic Health Resource Center. We provided transportation with grant funding from Bader Philanthropies to have the Hispanic Health Resource Center's Memory Cafe join our Memory Cafe out at the farm. We do a Hug a Horse event every year where we basically go out to a farm and they bring out their horses and their donkeys and their goats and their chickens. And there's nothing that can unite people more than animals. So the different languages didn't really matter. We translated everything, but it was really great to see the participants asking what the different words were in both English and Spanish for the animals. And last, there's a picture. I'm actually holding up brochures, bottom right, holding up brochures because I'm going to be dropping them off at the Senior Health Services Department at our local hospital. And I had posted this on our Facebook page, and another health entity wrote me and said, I want brochures too. So that was pretty cool. So now I drop off at multiple offices within that hospital because we have geriatricians and we have nurses, and the people who are diagnosing, they all want to hand out the brochures. So it's kind of that form of casual social prescribing. We don't get any monies for that, but we are so thankful that they're doing that for us. Our budget is largely based on our libraries have their own adult programming budgets. So that's how they are bringing in different speakers or how they pay for refreshments. They also utilize their Friends of the Library for program sponsorship. So Friends of the Library groups are often like the fundraising arm of a library. So some libraries will say to their friends group, could you offer to pay for refreshments or this special event? That sort of thing. And then last, we've also benefited from different philanthropic sources over the years. I mentioned Bader Philanthropies earlier. We also were an award winner from Family Caregivers Alliance in 2022 for their innovations in Alzheimer's caregiving. So we received a monetary award for that. And the picture that you see on the screen was just amazing. I always wanted to hold a big check. So I'm grinning like just so happy there. And we had received over $7,000 from a 100 Women Who Care Milwaukee West event. So that was kind of like going on Shark Tank. I had 5 minutes. I had to explain what my project was. And this group of women chose our group to give their monies to over the other two groups that had presented that evening. And we actually benefited by submitting this to another entity who matched it at 50%. So we ended up with over $10,000 because those women cared, basically. And here is my contact information, which I'm sure will be shared from Ashley, but you can email me, you can call me, and then I do encourage you to look at our website, librarymemoryproject.org. If you look at our events tab, you'll see all the different events that we have coming up, and you can kind of see the different activities that we offer at our memory cafes. And now I am going to turn it over to Kathy. And if I can share anything else, I certainly will.
Thank you so much, Angela, for sharing that information and just the system that has grown in Wisconsin. It's cool to hear, you know, how organically it's grown, and it just really highlights the need. And there's some really unique pieces there too. That the hosting, rotating hosts, things like that. That's new to me. So I will turn it over to Kathy and Emily with the Marion County Bold program. But Kathy, if you'd like to just give us an overview briefly about, you know, how the Bold program maybe supports or can support memory cafes, and then we can kind of open it up a little bit more to conversation. And Angela, you're welcome to hop in as well.
Sure. Thanks, Ashley, and thanks, Angela. Those are great overviews. So as was stated, Emily and myself work at the Marion County Public Health Department here in Indianapolis, Indiana. And when we first got the BOLD grant, we connected a couple of years ago. We connected with the Dementia Friendly Indianapolis group as they were already started and working in this area. And so we joined that group, and one of their big focuses has been to expand memory cafes in our area. So they have several that they're working with different partners, and they identified those partners. One of them I'm going to focus on today is a memory cafe that takes place at Centerwell Senior Primary Care Clinic. So this is a little bit different in that it's at a primary care clinic. So they just started this memory cafe about late last year, and it's held once a month. It's the same day and same time every month, and then it's 2 hours. And it's free to participate. Our main role from a public health department standpoint is helping with promotion. So from our standpoint, you know, we are aware of the monthly cafes, and we share information about those cafes with our coalition. We have a brain health coalition that we started about a year and a half ago here, for which the health department and the Alzheimer's Association co-convene. So we share that with our partners, and then we also share information about the memory cafes with other community partners that may not be part of that coalition right now. And so we ask them to share with their networks to try and get the word out there, especially since this is still a newer memory cafe, to make people aware of it. In addition, here at the health department, we're a rather large health department. We have a whole social work wing, and we have a number of clinics. And so we share the information about the memory cafes with the social workers and the nurses as well, so that if they come across anybody who that might be a helpful resource for, they can share that with them as well. So it's another way to get the message out in the community. We've also done some work just kind of going to libraries, on the community boards, and at other places, and putting flyers up and things of that sort to help raise awareness. So that's been our major role to date. As part of the Dementia Friendly Indianapolis group, members are asked to volunteer at the memory cafes. So we're actually going to be volunteering at the July cafe. So we're coming up with the activity, and we'll be there running the activity and help supporting the cafe. I also wanted to note from a public health standpoint, one great thing about this particular cafe is with it being at a primary care clinic, the clinicians there are encouraging anyone who comes in, or any of their patients who have dementia, or that may be care partners or caregivers, they're raising awareness about the memory cafes that take place each month there. And essentially they're giving them a flyer, they're pointing it out to them, and kind of telling them a little bit about the memory cafe, and sharing that with them as a helpful resource. So that's a way of kind of, raising awareness to and prescribing that source. As I've been listening, and from getting a sneak preview of the toolkit that's going to come out, I just would also like to say that I think I've come up with some more ideas today and yesterday about additional ways we can promote, and some of the other healthcare systems that are involved in our coalition, to see if we can spread awareness even further. One thing I didn't mention is, while this memory cafe is housed at a primary care clinic, it's open to anyone. So you don't have to be a patient at that particular clinic. Of course, that's easy to get that information out to the folks who are there, but it's open to anybody in the community, as Centerwell activities are open to, beyond the memory cafe, their other activities are open to folks as well. And then from a public health perspective, I mean, you've heard the benefits of the memory cafes today. So I think from a public health perspective for us, we're kind of looking at this as growing community clinical linkages. This is a great place. And then also thinking about the people living with dementia, the care partners or caregivers, in terms of their health and well-being. Like, this is a great opportunity to get out and socialize, get some emotional support, and build those meaningful connections. So that's why we really see the value in these. And I think over the next few years, our efforts will expand in terms of what we do in the memory cafes that are already in place in the county, and seeing if we may be able to help grow upon this.
Thank you, Kathy, for sharing. Really interesting to learn about the memory cafes taking place in a clinic. And Emily, this might be something that you can speak to, but I'm wondering if you could talk a little bit about how you track and evaluate the impact of memory cafes.
Excellent question. Excellent question. So I will just say right up front, this is such a new thing for us to be diving into. We are just getting our feet on the ground with the program, running into phase 3 of, or I'm sorry, the implementation phase of our program. And so we don't have every single memory cafe, connection to the BOLD program right now. But as we get started, I think one of the largest focuses for tracking and evaluating the impact of these programs is just who I guess are the demographics of the participants. Where are these cafes being located? Are they in areas that we see high rates of dementia or caregiving? And what does participation look like? Is it something that people are actually going to? And eventually, right, we want to see some feedback on their experience within these memory cafes. And also, in my own future ideal world, talking with the facilitators to see, how is this going for them? What are their needs? How can we support more than just promotion? But there are a lot of different challenges that I know we'll talk about later as far as tracking and implementation go, as far as health systems not knowing necessarily that these memory cafes exist, not socially prescribing these things at their primary care office, and more. So hope that answers your question.
Thank you. And Angela, I'm not sure if there's any specific, tracking evaluation that is done on your end in the libraries.
So we do have our new attendees fill out a new attendee form when they come to our memory cafe, and that just includes their contact information. And then we have a how did you hear about us? And so we will ask them, did you hear about us through a flyer, our website? Did your healthcare provider refer you? Or was it from our dementia care specialist or other? And it's interesting because that hospital that I highlighted earlier, they're really pushing it quite a bit. And we do get a lot of people that are coming to the Waukesha Public Library Memory Cafe saying that they heard it from that hospital, and they'll even indicate who the provider is that has sent them. So that's pretty cool.
Very cool. Thank you. And Angela had talked a little bit about, how they're sustaining their programs, and Kathy and Emily, I'm wondering, how that might be similar or different in the setting that, you're talking about.
Sure. So there is an organization locally that has provided some grant funding for the memory cafes to Dementia Friendly Indianapolis. And essentially they've put out requests for those, including within the faith community, so even beyond the clinical setting. For those that are interested in starting up, they have the expertise and someone who is specifically working with the memory cafes there. And so that is how they are focused on sustainability at this point.
And you had mentioned that, those that lead the memory cafes are volunteers, right? Am I understanding that correctly?
Mostly. Essentially, there's one person there who's the community health coordinator at Centerwell Primary Clinic. And so she's there every memory cafe, and she's promoting through their organization. And so she's there every time. So she has the experience from each one. And then us volunteers come in and we're asked to do dementia training online to kind of be aware of interacting with folks with dementia and caregivers. But then we come in and help run the activity, but she's also there as the person who's familiar with doing this more often to help us volunteers.
Sure. Got it. Thank you.
I can talk a little bit about training. So for our memory project, unfortunately, the Memory Cafe Alliance was not in existence for me, but I created my own training for our librarians. So they get a facilitators training manual that they read ahead of time. And then I ask them to attend 1 to 2 memory cafes for observation. And then I meet with them afterwards. So it's a flipped classroom approach so that they're taking in the information first. And then I'm meeting with them afterwards to answer any questions that they have. And then we talk about, what do they envision for their first couple of memory cafes, that sort of thing. And then I also attend their very first memory cafe. And then I give them feedback afterwards. Like, I love how you did this, but here's something that you could probably, work on implementing next time. And then I do, I do attend different memory cafes throughout the year, but it's usually new memory cafe facilitators, or maybe they have a new special guest that I want to kind of check out to see if I want to recommend that to other people, that sort of thing. And then I do host annual meetings with the different project groups, as well as a one-time symposium once a year for all of the memory cafe facilitators to come together and to learn from one another. They also have the opportunity to meet with our dementia care specialists to ask any questions about dementia in general. And then I encourage all of our libraries to become Dementia Friends trained for all of their staff. So that's something that can be repeated every couple of years because of staff turnover.
Yeah, that's great. I think, some sort of standardized training, as we see with the Memory Cafe Alliance, can be a huge support too for sustainability and making things, what's the word I'm looking for? People know what to expect across the board when they attend a memory cafe to an extent, right? Because they do differ. But thank you for that. And I'd like to pose a question to those attending. This was something that came up as we were planning the webinar and learning about, the programs in Indiana and whatnot. But we're wondering, if any of our attendees are aware of clinical providers that are hosting memory cafes that they'd like to share. Things, something that we can learn a little bit more about and share as well. But Emily and Kathy, was there anything else that you'd like to add before we turn it over to Beth to talk a little bit about social prescribing?
I would just note real quick, I know there's a question in the Q&A about specifics on the clinic model. And I would say at least the particular clinic I'm referring to, it's more informal. If someone has a diagnosis of dementia, or if the provider is aware that the individual is a care partner or caregiver, then they raise awareness about the memory cafe. So that I'm not aware of it being something that goes into an electronic medical record or an EMR at this point in time at that particular facility. But there are maybe other models out there. And thank you.
Yeah, I don't think I have too much to add, and one of the big reasons being that, this is still a little bit new to us, and I'm also fact-finding on this webinar along with others. But I think it's really important, and we're perfectly poised to sort of develop that standardized data collection that would sort of provide the foundation, to deliver the evidence of impact, right, of these programs. I mean, it's nationally known, right? But when it comes to your own community, your own program, showing where you're holding these cafes, who's able to participate, how you can improve, things like that. If you're just starting out with memory cafes, these resources are going to be an excellent support to get started and sort of develop that initial evaluation plan or tracking plan.
Great. Well, thank you both for sharing your experience in the clinical setting. I would like to turn it over now to Ms. Beth Solzberg to talk a little bit about social prescribing and what it looks like in practice in the clinical setting. So Beth, thank you for joining us, and I'll turn it over to you.
Thanks, Ashley. It's been great to listen to all the presentations so far. As Sam mentioned, JFNCS of Greater Boston, where I work, has been running a memory cafe and also a learning community for memory cafe leaders called the Memory Cafe Percolator for over 10 years, and we're now helping to build the Memory Cafe Alliance. Over these 10 years, we have heard again and again that the biggest challenges that memory cafes face is reaching potential participants and sustainable funding, these two challenges. And social prescribing has potential to help with both. So first, I want to just briefly define what social prescribing is. It's a simple concept, but it can be hard to implement. Simply, medical providers write a prescription for their patients to participate in some kind of activity to meet their health-related social needs. Next slide, please. And it is not always the case, but for scale and sustainability, there really need to be these two components that you see on screen. There needs to be some type of link worker to make and support matches between patients and activities. Otherwise, it's too time consuming. And then there needs to be a payment to the activity provider to help with the sustainability of community-based programming. Next slide, please. And so what is the motivation behind this movement towards more social prescribing? It's really an awareness and more data to support the health impact of the social determinants of health. You can go on to the next slide. And we see that in many parts of the world, social prescribing is well established, but it is new in the US. And we have a very fragmented payment and provider system here in the US, which makes it a little bit harder for the benefits of sort of primary care and preventive services to be captured, and that's probably part of it. But in any case, there is an increased recognition in the value of making these linkages between the clinical and community service world. Next slide, please. So what I want to do now is just describe to you 3 ways that we can talk about the structure of social prescribing. And these are not formal designations, but they really are a description of what social prescribing looks like from the perspective of memory cafe leaders. So the first one we'll talk about is unfunded prescribing. And this is what you've been hearing about from some of the panelists today. A memory cafe leader reaches out to local medical providers, brings flyers, provides other kinds of information about the memory cafe to encourage referrals. And this is common practice. It happens all the time, but it's challenging in the absence of any kind of link worker. It really is kind of do it yourself. Next slide, please. And so it benefits memory cafes through increased referrals. That makes a big difference because we want to serve people. It's often hard for those folks to find us and us to find them because there is so much stigma and silence about dementia, and also because a lot of people don't know what memory cafes are. So those referrals matter. However, no funding is provided through this unfunded approach. And this outreach is sort of a whack-a-mole kind of process. It's time consuming, and then if the memory cafe schedule changes, let's say, or if there are changes in the healthcare organization, maybe turnover, you have to do it again. There's nothing kind of, no structure really supporting it. And we do find that medical providers are commonly really too busy to make referrals like this, especially because they often are not very familiar with memory cafes. Next slide, please. And so this is a slide from the results of a survey that the Percolator Learning Community did in 2023, 156 respondents. And the point here is just that only 4% of memory cafe leaders who responded said that providers in their area, most of them are familiar with memory cafes, and also a whopping 20% were not sure. So I think this speaks to the silos that tend to exist between the medical and the social care communities. Next slide, please. And we do hope that the CMS guide model, which is now being implemented in many locations across the country, may help by providing an incentive to medical providers to make referrals to community-based services and also adding a navigation function. And we are also so thrilled to be with you today and really connecting with the public health community. And it was wonderful to just hear Kathy and Emily share some examples of how they are supporting the memory cafe in their community and helping local medical providers understand the cafe and help people make their way there. Next slide, please. For the sake of time, I'm gonna just summarize here that Massachusetts and Wisconsin are the 2 states with the most memory cafes. And so we do see that there is more awareness among medical providers of memory cafes, but even with that, there really are very few referrals that come from medical providers. Next slide, please. So now we're going to talk about philanthropy funded prescribing. So foundations and other funders like the National Endowment for the Arts, for example, have supported social prescribing in specific communities. Next slide, please. And these are generally time limited. An example would be Culture RX, which was a collaboration between the Massachusetts Cultural Council and Art Pharmacy, which ran for 3 years in Massachusetts. Next slide, please. And we find that these initiatives don't always have a link worker. It is an expensive component, but it is really critical because without this, the sustainability is limited. Next slide, please. So in Massachusetts, after the 3 years, an evaluation was done, and what we saw was that patients loved it, medical providers loved it, social care providers loved it, but the providers all said, we can't really keep this up without help because it's so time consuming to make these matches ourselves, which leads us to the very next model, which is the one that's really most hopeful over the long term, which we're calling integrated prescribing. And in this model, health plans and health systems pay an intermediary that has a link worker function to make and support matches, and they also pay a fee to activity providers such as memory cafes. Next slide, please. And so an example of this is Art Pharmacy, which has now rolled out across Massachusetts and many other parts of the country. And what we are finding is that we're sort of in a transitional phase where health systems and provider and payer systems which have signed up with Art Pharmacy are kind of in a wait and see mode, and they're only allowing the parts of their patient population with the highest costs associated with them to take part. And they really want to see a demonstration that social prescribing will manage costs and improve quality and patient experience. So as far as I'm aware, at this point, memory cafes have not received one of these formal prescriptions through an intermediary like Art Pharmacy. But if any of you has received one or has made such a prescription, we would love to know. And with that, I want to go ahead and hand it back to Ashley to wrap us up.
Great. Thank you so much, Beth. That ties in, so nicely with the model that Kathy and Emily were talking about. And it's interesting to hear that even the states with the highest numbers of memory cafes where providers may be aware of them, that, there's still work to be done with how we can get those providers to recommend these resources in the community. So thank you for that. And we will have just a few moments here for Q&A. Please do continue to add questions to the Q&A, and thank you to our speakers for responding to them. I do just want to very quickly touch on, we talked about a new toolkit that we've put together here at the Public Health Center of Excellence on Dementia Caregiving, and it really pulls together all of the information that's been shared today. So we were really happy and lucky to work with those on the call here, and those with EMC Squared and the Memory Cafe Alliance to kind of streamline some of this information into what we hope will be a pretty straightforward, easy to follow guide for public health agencies, to bring memory cafes to their community and help launch them sustainably. The toolkit's broken into two different pieces, one specific to public health agencies, which really summarizes a lot of what we've talked about here today, kind of the what and the why, and even a piece about social prescribing as well, and those different payment models that Beth just spoke to. And then the second part is specific to memory cafe leaders and walking through what Sam had talked about a little bit, the trainings, the step-by-steps of, what should a memory cafe leader, go through in order to launch their memory cafe. So it is not available at this exact moment, but by the time our webinar wraps up and we share today's slides and recording, I'll also be able to share a link to this toolkit itself. So for those of you who have attended our webinars before and are familiar with our work, you're probably familiar with the many different toolkits that we do offer available to the public. Here's a quick guide on how to find them on our webpage. We do have our toolkits, and then you'll find our new Memory Cafe toolkit located on the second shelf. Again, if you look right at this moment, it's not there, but it will be in the next day or two. So really excited to share that, and we are excited to see it come together. Everything that we talked about today really complements it nicely. So with that, I'd like to turn it over. We have about 5 minutes here just to address any last comments, questions. I know that we've already had quite a few come through. If any of our speakers here have anything that they'd like to start talking to, maybe something that we didn't talk about today, you're welcome to open up your mic and join us for conversation.
I'd love to just reinforce that there is a lot of help out there for you if you are interested in starting a memory cafe. There was a question in the Q&A from JM on that, and I answered it in the Q&A, but I just want to encourage everyone to visit the training modules at the Memory Cafe Alliance website, and one of us can put that link in the chat again. And also the percolator page, which you can find those both in the Q&A. And know that there's a lot of Memory Cafe leaders out there who would be happy to share with you what they've done. It's an incredibly generous, creative community, and we have lots of ways of helping people talk to one another. So you're not alone, and it's really great to build on what has been learned by leaders like Angela over a decade. So you definitely don't have to start from scratch.
Well, I think the nice thing is with the Memory Cafe Alliance and all these resources now, starting from scratch, hopefully doesn't happen, because all of these resources are at our fingertips. And there's so many resources in the chat and in the Q&A, and one of the questions earlier was if these resources will be shared, and we will comb through these comments and chats and make it a little more usable, but we'll share all of these resources. One, I guess, comment that I saw and question that kind of came to my mind was, with the nature of memory cafes, some attendees can only plan ahead so far, right? So how do you recommend, maybe Angela or Kathy, from what you've seen, or Sam, how do you recommend locations, potentially having an RSVP, but allowing that flexibility, but then also having, the resources, the things that are being purchased for these memory cafes, and using them in a way that they, are used, there, nothing, necessarily goes to waste. How do you plan for something that might be hard to plan for?
I can take this one. So a lot of our memory cafes will say registration preferred, but not required. And that is just so that the librarians can get a general idea of how many are planning to attend. So are they expecting 20, 40, 10, that sort of thing. But you have to recognize that sometimes people will sign up and then they can't attend. Or you might get people that drop in. So it's just kind of a general gauge to take an RSVP. I have another library that doesn't take one at all, and it seems to work out just fine. They have pretty regular attendance, between 12 and 15, and that librarian just scales up or down depending on, what happens that day. So I think the thing to be most aware of when you're offering memory cafes is to be flexible for all aspects.
I so agree. And just to tack on another little tidbit to Angela's guidance there, if you're starting a new cafe, you might focus on activities that are not really limiting in terms of the number of people. So rather than, say a craft activity where you have to have a certain number of kits, if music is the easiest, most engaging, most accessible, I think most cafes find like music is something that everyone loves and is very accessible, and it's not something where if you have a few more people or a few fewer people, it really matters. So especially as you're getting started and sort of getting to know your crowd, and then over time it kind of evens out, doesn't it, Angela? I mean, it's amazing. And Susan as well, who's been running a number of memory cafes for many years, even with the variability and who actually is able to attend, you get sort of a feel for the numbers.
Sure. Susan, did you want to add to that? It looked like you maybe had something to say.
No, I absolutely would agree with Beth. We never know really how many people are going to come. So we just have to be flexible. And in the beginning. You might not get too many. You might have more volunteers than participants, but that's okay. Just keep working at it, and people will come. So yeah.
Persistence, yes. Well, thank you all. That does actually already bring us to the end of time for our webinar today. Thank you again for answering the questions in the chat and Q&A so that we were able to get to more of those. Thank you all for attending today. And again, I'll be sharing a email with a link to today's recording, the slides, our new toolkit as well, as long as some resources from the Memory Cafe Alliance and all that fun stuff. So thank you so much to all of our speakers here for joining us today and sharing this information.